Hello, everyone. I'm Maureen Flynn, and I'm a member of the National Quality and Patient Safety Directorate. And it's my real pleasure to welcome you to our seventh and our last QPS Talk Time of our Autumn Winter Series 2022. Moving forward, shaping the future, health and social care quality improvement, Northern Ireland strategy is going to be the focus of our conversations today. We're delighted to be joined by Levette and Clifford Mitchell, our esteemed and great friends in the quality improvement world in Northern Ireland. What we're going to be hearing about today is the landscape for quality improvement in Northern Ireland, reflecting on the key drivers and objectives of the recently launched strategy. And Clifford and Levette are going to be sharing with us the highlights of the strategy and hear about how Northern Ireland is working as a connected learning system to support the wide-scale adoption of successful projects, really influenced by cutting-edge thinking on learning health systems. So I'm going to now introduce our speakers for this afternoon. So we have Levette with us, who's Regional Senior Improvement Advisor from the HSCQI Hub. And many of you will have met with Levette over the years on our multiple collaborations in an all-Ireland basis in the world of QI. Also to introduce Clifford. Clifford Mitchell is Regional Senior Improvement Advisor with HSCQI Hub in Northern Ireland too, and many of you will have also met with Clifford, who's a particular interest in patient partnership and measurement, I know, so we've collaborated on many things together. And my friend and colleague Roisin Egenton will be joining us for the conversation following the presentation. And Roisin is a member of the QPS Improvement team, and our colleague Veronica Hanlon will also be joining the conversation, and she is an educationalist with the QPS Education team. And Juanita Guidra, who's on the call with me, is my colleague in the QPS Connect team, and she's going to be taking all your thoughts and ideas from the chat box to weave into our conversation. So how today will run with Levette and Clifford will speak with you for about 20-25 minutes, sharing with you their insights, and then we'll move into conversation. So over to you, Levette, and thank you for being with us.
So thanks, Maureen, to you and to all at the QPS team. As you say, we've had many collaborations over the years, so it's great to just be able to have a conversation with colleagues today on an all-Ireland basis. And for this opportunity to really share with you where we are in terms of our journey in Northern Ireland around quality improvement, a little bit about ourselves as health and social care quality improvement, and then to share with you our recently launched strategy that you'll see behind me in my little background, and also the link into the chat box function to share with you as well. As Maureen said, I'm joined today by my colleague and friend, Clifford Mitchell. And once I've given you an overview of the strategy, Clifford is going to give a little bit more in-depth information around how some of our goals and aspirations within the strategy are actually being manifested on the ground into a programme which we have a particular focus on and a mandate from our senior leaders. And we talked a little bit about leaders earlier there, around why is leadership important, which is really aligning our regional quality improvement effort to supporting improvements in timely access to safe care. So what is HSCQI in Northern Ireland? Well, it was established in 2019 as a hub and spoke network. It is a supportive infrastructure for quality improvement in Northern Ireland, and it has its roots really based on a number of reports and reviews that were written over a 10-year period, really to support the enabling of transformation across our system in Northern Ireland, and that quality improvement be one of the key building blocks within that. And specifically, one of the documents mentioned that we need to identify current innovative projects that would be at a local level, but we could then take to scale and spread across the region. And that really has been our focus over the past 6 to 9 months. And that's what Clifford will share with you later on today. So the network is made up firstly of the hub where Clifford and I are based. It's small but beautifully formed. And we are part of the Public Health Agency in Northern Ireland, led by our director, Dr. Egenton. The spokes of the network really are our quality improvement leads working out in each of our trusts, in primary care and other parts of our system. And they really connect us up with the front line and the improvement work that's going on there. As I talked about, our work is overseen by our HSCQI Leadership Alliance, which is made up of all of our chief executives of our trusts, of our arm's length bodies, our senior professional officers at the Department of Health, representatives from primary care, and we have service user representation on that group as well. And they really steer our programme of work. And all of these groups then connect up with our ever-growing group of staff in Northern Ireland who are trained at a high level in quality improvement, what we call our level 3. And they're now classed as our HSCQI alumni. And we try to direct them to the pieces of work that we're leading on across the region, so as we align efforts around improvement, but we also support them through a programme of alumni sessions. So therefore, the purpose of HSCQI is to connect improvement across our integrated health and social care system in Northern Ireland, to build QI capacity and capability, to support efforts to reduce variation, not only in processes, but in entire systems, and to break down silo working that we know still prevails within our systems today. So this is our strategy moving forward, shaping the journey. We launched it with the Minister back in the 19th of October this year. And this strategy really does mark a significant milestone in our transformation experience in Northern Ireland and how we're aligning our efforts around quality improvement. So the strategy was developed during a series of meetings and workshops over around 15 months. That looks like a windy road there. Can I tell you it was a very windy road as we managed our way through various waves of COVID and pressures on our system. But nonetheless, this strategy, which was developed during an era of COVID, has to serve us, and it will be implemented during an era dominated by system recovery, of rebuild, of repurpose. We have written the strategy as a live document, and we intend to review it on an annual basis. Our vision for the strategy really is very ambitious. We want to inspire and influence Northern Ireland's health and social care community to become a global leader in quality improvement and innovation by working together, focusing on person-centred care. And throughout the workshops that we ran and the conversations that we had, we kept coming back to this. We kept coming back to we need to be aspirational. We need to look to the future. We fully recognise the challenges that we have in our own system then, and particularly in our system now as we move through a very challenging winter. But we need to have that vision for the future. We need to be able to look ahead. So what are the 4 building blocks of our strategy? In other words, what are our 4 primary drivers? So building a learning system, and Clifford is going to talk to you about that shortly. Supporting the system to apply QI methodologies and build capability within our system. Developing leadership for improvement, and supporting system-wide partnership working and co-production. It will be of no surprise to you that us working together as a connected network of improvement, sure, we had to go for a driver diagram. And that driver diagram really did help focus our efforts around what should be our primary drivers and what should be our secondary drivers to try and lead us to the success that we wanted to achieve. We're in the process now of engaging wider across the system to look at what our implementation plan will be around each of those primary drivers and then strategic goals. And you'll note if you've opened the strategy in front of you, it's laid out in short, medium and long-term goals. And the short-term goals are 3 to 6 months. So we were given no credit from the system to say, we need you to be able to produce this work and do it with agility and do it at pace, because that's the world that we live in now. We live at change at pace. So we'll take you through some of our achievements so far on some of our elements of the strategy. We'll not go through it point by point. But if we look at building capacity and capability, we have commissioned and we are co-delivering a Scottish Improvement Leadership Programme in Northern Ireland to take us to that level 3 advanced level of training. It is underway at the minute with 32 participants, and they will graduate in March 2023. And we're doing it all virtually. So it's a whole new world of hurt for us all, trying to deliver advanced QI training programs online, but we're getting there. And again, in that effort to align all of our work to our mandated program from the Alliance, we have asked each of those participants, their skill project, their improvement project has to be around timely access to safe care. So I often say it's about lining up all the wee boats in Dunkirk. It's about getting everybody going in the same direction so as we really are maximising that effort. We have established a subgroup to review all aspects of quality improvement training in Northern Ireland. We currently use the Northern Ireland Attributes Framework, which lays out the 4 levels of training that you can achieve in quality improvement. And we have a key principles document which articulates what the curriculum should be and the faculty should be to deliver those programs. But it's probably around 10 years old now. And we think it's time. It's time to review. It's time to refresh. It's time to make sure that it's fit for purpose. We are collating a database of our staff who are trained at that advanced level, and again in that effort to be able to align those individuals with what is our strategic priorities so as we can use that quality improvement approach and lens to drive forward. And we're looking at what a level 4 program might be moving into the future for our executives and our non-executives as they work in those leadership roles to support those on the front line delivering improvement. And that leadership, I would say, is so important. So we have recently appointed a new chair to the Alliance, and that is Dr. Cathy Jack, who's the Chief Executive of the Belfast Trust, our largest trust in Northern Ireland. And Cathy really has been central for us achieving this work around motivating and mobilising the system around timely access to safe care. Cathy is only our second chair. And many of you will know Dr. Anne Kilgallen, who was our first chair and retired last year. And Anne really was central to getting us to pull together this strategy and actually for the establishment of HSCQI. So the Alliance are working away with an agreed and refreshed terms of reference and a real energy around keeping the system and motivating the system driving forward. And we continue in that leadership role to link with our great colleagues here in the Republic of Ireland, but also with our colleagues across the rest of the UK and beyond, as we try to learn from each other and share together. And that is all about partnership, working in co-production. And we have Tracy, who I see joined the call here today. Tracy is our communications lead, and that role of communications really is so central to us in getting the messages out there around communication of improvement, but also around motivating individuals to become involved in improvement activity if they haven't already done so. Tracy has established a quality improvement ambassadors group for communication, so they link into all of our organisations, and they're in the process of co-designing and developing our communication strategy to drive forward that work. We're linking with colleagues in care opinion to better understand how we can triangulate data from our service users and get that real richness of lived experience into our quality improvement programmes of work. And we link with Maureen and the Q community as we work together to try and grow that as an energetic, mobilised and motivated group of individuals moving forward. Our last slide is around building that learning system. And I'm going to hand over to Clifford, as I said, is going to share with you the work that has really taken up our waking and sleeping hours over the past 6 to 9 months as we've tried to develop our learning system approach. Clifford, over to you.
So yeah, Levette set the scene for what I'm going to talk about now. So what I'm really going to do is go through a brief overview of learning health systems, what they are, and then also how HSCQI is applying this approach to support our timely access to safe care programme. So if we start off thinking about, so what is a health system? So here's one definition from a recent Health Foundation publication called Developing Learning Health Systems in the UK Priorities for Action. And I've just highlighted a few words in bold. So community of stakeholders, ability to learn, improve as a result, and continuous learning and improvement of services. So really when we talk about learning health systems, it's not just about sharing good practice and innovation. Really, it's about sharing with purpose for the purposes of spread and scale. And there has been increasing focus on learning health systems since they were first described way back in 2007. And increasingly, organisations are looking for scalable frameworks to support continuous learning and improvement of services. Okay, so in the recent publication called A Framework for Understanding, Designing, Developing and Evaluating Learning Health Systems, Foley and Vail propose 4 key questions to ask when you're starting to develop a learning system. So what is the rationale? Why are we going to do this? What do we hope to achieve? And then it's also about understanding the sources of complexities that exist at a system level, and what strategic approaches to change do we need to consider. And additionally, when we're sort of looking at these points 2 and 3, it's also important when you're developing a learning system to match the complexity of your strategic approach with the complexity of the system that you're dealing with. And then finally, it's what technical building blocks will we need. So our learning system must be supported by technology. So what is our rationale? Well, I'm sure this will resonate with all of you. It's to improve patient outcomes and experience, and also to provide timely access to safe care. It's also about identifying and reducing unwanted variation and equity. And then more specifically from a learning system perspective, it's about generating knowledge and optimizing the application of that knowledge. So data-driven and using that knowledge to support scale and spread. And I suppose additionally then for HSCQI, we want to test a new way of working. So while regionally, you would say that we're working collaboratively, we're not following the purest IHI collaborative model. Instead, and this is a key point, we're using a hybrid approach, and really our focus is on flexibility and adaptability. Okay, so if you consider our aim, and Levette mentioned our Leadership Alliance, and they really give us the mandate. So their mandate was that the overarching priority of timely access to safe care should be the focus of the HSCQI network going forward. So really our end goal is regional scale and spread at pace. But really to achieve this, we need to effectively engage with the wider system. And to do this requires an understanding of that system complexity, and also then with that developing very strategic approaches to support the region. Okay, so sources of complexity. So we're looking at continuous increasing pressures on patient flow and waiting times. You only have to listen to the news every day. There's issues with patient flow, there's delays, our waiting times are ever increasing, and there's also issues with staffing levels. And we also know there's variation in the system. So there's variation with even our data systems, there's variation with analytics expertise, there's variation in processes and capability. And then additionally, just to add to that complexity within our timely access program, we have a number of projects, but they're all at different stages of maturity. So then we need to develop strategies to support those teams. So here are our program work streams. So we have 6 work streams. Key here is that our trusts and the system had autonomy to identify their projects linked to local strategies and priorities. And at the minute, we have approximately 23 projects identified from our 5 hospital trusts and also NIAS, or Northern Ireland Ambulance Service. So these teams are part of our learning community, and our focus really is to learn from each other and to support each other. Our first timely access learning set was just recently on the 4th of November, and there was real energy and commitment from these teams, even at this early stage. Teams were sharing real vital knowledge with each other, and there was a real, just a buzz in the room, which it was just, after coming on such a long journey, it was just a really great thing to see. And our next session is on the 15th of November, which is in a few days' time on Thursday. And again, we're supporting their teams. So this session is going to be focused on demand, capacity, activity, and queue. And this, again, was going to be delivered by our colleagues in NHS Education for Scotland. And we hope that this session will support our teams with regards to patient flow. So again, what strategic approaches to change do we need to consider? So our focus really is from the onset that we would have a hybrid model. So the key to this is really being flexible and adaptive. So we're on a journey within the region. So we don't necessarily have all the answers right now, but we will learn and adapt as we progress. So we have co-designed our learning system, and we will continue to connect with the system with regards to that. So we co-designed our regional driver diagram and our program charter, and our ongoing evaluation process will support us to adapt and be flexible. We're also using the IHI framework for scale and spread, and I'll talk a wee bit more about that on the next slide. I also spoke earlier about technical building blocks. So at this early stage, we're using SharePoint as our platform to enable teams to share progress and report on progress. But as we move to the next stage, we may require a more sophisticated IT solution. And finally, it is also vital that we evaluate the effectiveness and impact of our approach with a robust evaluation framework. Okay, so this is the IHI framework for going to full scale, and this again has been endorsed by the HSCQI Leadership Alliance, and this is really our program roadmap. And this model is based on the rationale that the more that we can provide clear evidence of how an intervention can be implemented or adapted, and the more we can demonstrate improvement and the value of that content in a range of varied settings, then the more likely it is that scale-up will occur. So as you can see, there's 4 stages. So setup really is about understanding the current state and developing theory. Building the scalable unit is around creating change ideas and developing change packages. Test and scale-up is around adapting and validating that change package in different contexts. And then finally, it's going to full scale. The model is also underpinned with adoption mechanisms and support mechanisms. And what these do is really they describe the conditions necessary for success. And these conditions are replicated in our co-designed regional driver diagram. So we're following we're going to follow a 2-stage approach. So in stage 1, improvement projects will be tested locally within trusts using recognized QI methodology, data, and evidence. So during this stage, there will be a focus on gathering and sharing local learning in order to inform system-wide transformation. So sharing local learning at a system level will be through a series of face-to-face and virtual workshops. And our aim is at the end of stage 1, projects that have evidenced improvement will be identified for regional scale and spread. And that then will be moving into stage 2. As I said, we have 23 projects, and we recognize that projects will be at different levels of maturity during stage 1. But we see this as a positive, with lots of opportunities for sharing and team supporting each other. So the key message for our teams is that this is not a race and this is not a competition. This is about sharing knowledge, supporting each other, and working together to develop projects that have potential for going to full scale. So one of the most important functions of a learning system is the ability to share knowledge at pace. So we have a secure SharePoint site that trusts and project leads have access to. So teams are able to upload their change package documentation and data, and teams can also access each other's data. So this is really important for learning at pace. Our SharePoint site has a tile for each of our work streams, and it also has a tile where teams can find documents and templates and useful resources to use. Importantly, again, this is about the technical building blocks. So again, going back to our colleagues Foley, It's about really taking practice and turning that into data, so quantitative, qualitative data. It's then turning that data into knowledge, and that's using QI methods and data analysis. And then finally, it's about converting that knowledge into practice, so the development of change packages for adoption or adaptation. So just to summarize this and bring it all together, so in the center of our program, we have the IHI framework for going to full scale. This is supported by leadership, so leadership at a regional and local level. And we call this enabling leadership to create an adaptive environment or space for spread and adoption. So bringing teams together and supporting them. So this is where our networking comes in. So we're bringing together our key stakeholders, really who represent all components of the system to, and this is the key word, intentionally connect and work together. And we're using an action learning approach to facilitate the spread and adoption of innovation. So as I said, this is about utilizing local knowledge of context, judgment, and expertise, and also combining a range of skills to support each other and develop projects for scale and spread. It's also supported by regional strategy and priorities, and how that supports the system. Then underpinning all of this is the robust learning system components. So that's how we capture data. And it's also the technology that will support us to do that. And then finally, project management. So this is a big significant undertaking. So we are incorporating project management into this. And finally, then our evaluation. So we have an advisory group, and we're delighted to have such an esteemed group of people together. So we have QI teams and trusts. We have academia, so we have the University of Ulster, and we've also this institute. And we also have our colleagues down south, so our colleagues in Quality and Patient Safety Education team. And we have our R&D colleagues in PHA, and we've also colleagues in RQIA. And really, it's informed by quality improvement and implementation science literature, and also underpinned by a realist approach. So this realist approach is increasingly used and referred to in the QI literature. And by using it, we're hoping that we'll be able to contribute something to the evidence base for collaboration-based QI approaches. So the overall aim of our evaluation, The overall aim of our evaluation really is to evaluate the effectiveness of the new co-designed regional approach to identifying scale and spread and improvement. So there will be a different focus at each stage of the program. So for stage 1, testing projects for potential scale and spread, we're conducting a process evaluation. So this is because we're trialing a new collaborative-based approach, and we need to understand how the program functions within our complex HSC system. So this will include examining our processes around, for example, how we've identified and selected projects, project completion or dropout rates, and also the delivery of face-to-face and virtual learning sets. So things like attendance rates, participant satisfaction, etc. And then finally, at stage 2, the focus of the evaluation will shift to examine the impact of program on outcomes. So at that point, we'll be looking at local and regional outcomes data for wait lists and times. So that concludes my presentation, and thank you for listening. And I have a few references there that will be shared with you. And I'll now hand back to Maureen. Thank you.
Thank you so much, Clifford, and thank you, Levette, for sharing really eloquently with us. I think the one statement that resonates is how you're linking it all up, getting everyone going in the same direction at multiple levels, using the many sciences, the learning health system, improvement science, QI, measurement, bringing all those sciences together. It's particularly pertinent to hear about your review of your attributes framework, your database of your alumni, your alliance of leadership, your QI ambassadors, intentionally networking, and as Clifford has shared with us at the end, not a race, it's not a competition, but that you're sharing intelligently using enabling leadership. So thank you both for sharing so generously. I'm going to hand over now to my colleague, Veronica Hanlon, and Veronica is going to share with us some of her reflections from our own perspective, from a QPS education perspective. Over to you, Veronica. Thank you.
Thanks so much, Maureen. And many thanks, Levette and Clifford, for sharing. Firstly, I suppose it's always great to hear what's happening north of the border, because we've so much commonality, I suppose, around our approach to QI education, and we share the same challenges. And as Maureen said at the outset, we have been linking in with Levette and Clifford and colleagues over the last number of years, and it's been fantastic for us. So as some of you might know, in 2021, here in the HSC, we published our own QI Improvement Knowledge and Skills Guide and our QI Learning Journey. And that was really influenced by the attributes framework that Levette spoke about and the key principles document. So it's really interesting, Levette, to hear that you're going to revisit and review that, and we'd be keen to link in on that. But what our QI Learning Journey does is it aligns 3 levels of learning to a number of programs that we've developed so far. So we have our introduction to QI. Our level 1 is a foundation in QI for people who just want to get an understanding of QI in healthcare. And then our improvement in practice program is our level 2 program, which is for teams who have an improvement project, and they work on that project over a period of time. So it's very interesting to listen to what you're doing with teams around a particular theme. And like yourselves, we've had to move a lot of our education onto virtual or blended learning platforms. Our level 3 program, and very similar to yourselves, is for QI leaders or people who are in leadership roles. And we run that in conjunction with the Royal College of Physicians in Ireland. So I suppose we've spent the last number of years developing those programs, but we are a very small education team. And we're currently at the stage now where we're having to look at how do we, build up local capability to develop and deliver and support these programs in the system, and how do we sustain that. So what I love about your strategy, and particularly your driver diagram, it really speaks to the areas that we're beginning to look towards. So how do we build that learning system? How do we build local capability? How do we use that cohort of people who've come through our postgraduate diploma programs and develop that alumni? And how do we partner with patients and our academic partners as well? So they're all areas that we're realizing now we're going to have to pay attention to. So I suppose from a QPS education point of view, I'm really looking forward to following your strategy and see how the work progresses. Because always, I think you're always a couple of steps ahead of us, and we learn so much from yourselves, and you've always been very willing to share your learning. So we really appreciate that, and hopefully we'll continue to do that, because I think what you do up north, and particularly with this strategy, which is fabulous, will help us to shape the future of QPS education here as well. So thank you so much for sharing. It's been fantastic to see it. And I think I'm going to hand over now to Roisin, and maybe Roisin, you can share your reflections from a QPS improvement point of view.
Hi everybody. For anybody who doesn't know me, my name is Roisin Egenton, and I'm a program manager with the QPS Improvement team in the National QPS Directorate here in the HSC. Again, just to thank Levette and Clifford so much for that excellent presentation. And as Veronica said, there are so many synergies between what we're doing and what yourselves are doing. We're really led and inspired by yourselves. And I think there's a lot of opportunity for us to collaborate and even work together and learn together on this journey over the next year or even 2 years, as I know your strategy is through 2024. Just for anybody who doesn't know our QPS Improvement team, we're led by our program lead, Maria Lorden-Dunphy, and the team is comprised of myself and Dervla Hogan, who are program managers, as well as Kelly Gibney and Mary Lawless in our office team, and Kira Kirk, Muriel Pate, and Grania Malloy, who are on our national medication safety program. And the aim of our QPS Improvement team is to provide support, tools, and resources to build quality improvement skills, knowledge, and confidence. And our principal focus is to address the 13 common causes of harm that are outlined in our HSE patient safety strategy. So reflecting back on the HSCQI strategy that Levette and Clifford so eloquently presented today, I suppose one of the major reflections for me is it is such a fantastic structure for networking and building that community of QI. And as Veronica mentioned there, it is a really, really good way to look at how we can take the capacity and capability of QI that's out there and really build on it and build our community. You have your HSCQI Leadership Alliance with senior system leaders and service users, and it has that enabling leadership that Clifford mentioned as well. And your plan to map and build a repository of those who completed their QI training, as well as mobilize the agency of QI's trained staff. It's just so important, I feel, for mobilizing resources and building that community, and indeed spreading and sustaining quality improvement going forward. So as many people on this call will know, we have a fantastic Q community here in Ireland. We have monthly Q Tea Time catch-ups. We have a Q Ireland network map. And if you are not part of the Q community or part of the Q Ireland network map, Juanita and Maureen will be sharing a slide shortly to show you how you can become members. And as somebody who's co-hosted the Tea Time sessions, I thoroughly enjoy them from not only a QI learning and enthusiasm perspective, but fantastic networking ability all around the country. We have excellent QI capacity building. Veronica mentioned a number of them that will be outlined in the prospectus next year. And our team has also been leading on a number of national collaboratives. So many people would have participated in our PUTS collaboratives over the last 10 years for pressure ulcers. We also had a falls collaborative that unfortunately had to be paused due to the pandemic. We've had learning sets to address the deteriorating patient. And most recently, we've been awarded funding from the Q Exchange program for a mobile app to help healthcare professionals in improving the reduction of pressure ulcers and falls in systems, working with both hospital groups and community services to address them. So again, I think that the HSC QI strategy, and particularly that fantastic structure for networking and building the community for QI, is going to be really, really good. And I think we can work with you on that journey and learn from each other. And just the other thing I wanted to mention very briefly is the QI toolkit. So you did mention the HSC QI strategy mentions plans to develop a QI toolkit. And many people in the HSC will be familiar with our own QI toolkit that was developed in 2019. And it assists staff and service users in building and developing QI projects in their own services. So there are 17 tools and a checklist that were developed, and they're particularly useful for people who are even new to improvement. It takes them on the journey from the light bulb moment when you have an idea for improvement right through to making sure that your project has been down a QI path and that it's evaluated appropriately, and that to sustain and spread, which is really what we want to see, not the one-off projects, but the ones that can be built on throughout the community. So we'll be looking to work on our own QI toolkit next year. And again, the learning that we can share with our colleagues in the North, I think will be really important for us to work on our QI toolkit and your own as well. We can learn from each other. So those are my points. I could probably talk for an hour on this subject, but I won't. Instead, I will pass you on to my colleague, Juanita, who will tie together some of our learnings from today and go to those of you who have very kindly put some messages in the chat box. Thanks, everybody.
Thank you so much, Roisin. That's been really helpful, and to all of our panelists. With all of this work, I suppose when you're looking at it, there's so much from a strategic perspective. You're sort of saying, okay, how do we make this a reality? And the question that we've been asked on the chat, and also I suppose in general over the last few weeks, a few people have asked me, if you're working within a hospital setting or a community setting at the moment, and you want to get involved in quality improvement, but it's not necessarily seen as part of your role, how do you maybe start that journey? And maybe Levette, we might start with yourself, and maybe each of the panelists, if you'd one top tip for somebody starting out that wants to engage with this work, hears about these strategies and says, how can I get involved within my space? What can I do in that time? So Levette, let's start with yourself.
I often think if you're starting out on a quality improvement project, you need to get that intrinsic motivation, first of all, from within yourself. So start with what really annoys you. Start with the grit in your oyster or the pebble in your shoe, the thing that you keep thinking, I wish somebody would fix that. Because if it's going to fix it for you, it can fix it for everyone else. So that's always a really good place to start. From ourselves in the North, we do have our spokes out in the system. So we have our QI teams within each of our organisations. So if they're interested in getting some new learning around quality improvement, they can link through with their local QI teams. They can link through to our website, which has a wealth of information. And we shamelessly steal from you, Anita, and others with toolkits and links to toolkits across other parts of the globe. So getting that little bit of information under your belt about how to start off a project is also really useful. And then connecting with kindred spirits. So you can't do this on your own. You need to find people who you can wrap around you, whether that's subject matter experts or whether that's experts in quality improvement. So you get your little gang of helpful for the season that's to try and work out your improvement project. And then that becomes elevated. Once you get your teeth into something, any of you know who've been involved in quality improvement, there's an energy around it, which automatically begins to elevate it within the system. So make the most of your connections, use your intrinsic motivators, and tell your story, because there's lots of good stories out there to hear.
That's really, really, really insightful and really helpful, Levette. I think you've summed up a huge amount in a very short space of time. We'll ask Clifford the same question, just if there's anything else you'd like to add on top of what Levette has maybe mentioned.
My advice would be, start small. So QI, yes, it's a lived experience science, really. So you learn by doing. So you can read all the theory you want, but you really get that rich learning once you do. It reminded me back to when I started in the health service, and somebody showed me a process that was so long-winded, and I thought, I'm going to change this. And I didn't even know what QI was then. And I just did it. And as Levette said, it was something that I did because it was going to help me, and it was successful. So it starts small and build up your confidence and then connect with others. So it's about networking as well.
That's brilliant. Thank you so much for that. Veronica, anything you'd like to add into the mix there?
No, it's just interesting, Juanita. We're piloting our improvement in practice program at the minute, and we have a number of teams who are working on projects. And when we ask them where do they come up with their ideas for improvement, it's just as Levette and Clifford have said. They've said that they looked at what would make life better for our patients and for us as staff. And, what are the things that annoy us or drive us nuts, as you were saying, Levette. And together, collectively, then they went and looked for support in putting a project together or getting some training. But it is looking at what would make life better for the patient and for us. That's a good place to start, I think.
That's really helpful. Thank you. And Roisin.
Thanks, Juanita. I don't have much to add to what's already been said, but I think my mantra around QI is always think big, start small, and don't wait. So we always have our big, hairy, audacious goal, the BHAG, as we call it. Think big, go out there and win it all. But start small, like Clifford said. It doesn't have to be a massive project. It can be very small, and the PDSA cycles can be quite small. But don't wait. You don't have to have the QI qualification. You don't have to have done all the courses. Go to your local QPS lead in your hospital or community service or wherever you work and see if they can point you in the right direction and get started. And just see how you get on. As Clifford said, it's a lived experience. And as you do it, you'll learn on your own.
Yeah, I think all of those points are hugely valuable. When we start off this work, a lot of people sort of say it has to be perfect. I have to have the perfect plan. I have to be all 100% ready. And actually, I think starting off with what causes us the most grief, having the conversation with some of your patients or your people that you're meeting every day and your colleagues to say, listen, what can we do to make this better? And it is the small things. Start small and work up to that, and go slow to go fast, I think was another piece of really valuable advice that we've gotten from Dr. Michael Gardam a few years ago, go slow to go fast. It doesn't always change overnight. Sometimes it does, but it can take a little bit of time. And I think that all of these things help us put this really important work into practice on a day-to-day. So thank you to our panelists for sharing your insights. And just as we come to the end of our final QPS Talk Time for 2022, we just want to say thank you to the team who have made this happen. So Dr. Maureen Flynn, Dr. John Fitzsimons have been invaluable in terms of co-hosting our sessions this year, and to the support team who invariably make this happen every single time without fail, despite the beautiful, joyful challenges that can come with IT. In particular this year, Naomi Palacios, who set the framework for a lot of this work, has provided so much support to us, and training up a new team coming through. So Stephen Barrett, again, has helped us throughout the early part of this year, in particular in terms of getting the background set up for every QPS Talk Time and inviting all of our guests and our yourselves, the audience. As always, we want to hear your thoughts and comments for the next year's QPS Talk Time. We would love to hear things that are really important to you, things that you want us to talk about, to get guests on, to share, I suppose, learning from across the system in terms of the quality and patient safety thinking that's current, but things that are really important to you as well, things that are coming up for you on a day-to-day basis that you want to hear about. Let us know, and if we can find guests or experts, or if there's something you're interested in talking about yourself or sharing your expertise or knowledge on a project that you've worked on, let us know, because we do want to hear from you. The prospectus, if you're interested in developing your skills around QPS, it's worthwhile looking at the QPS prospectus for 2023, and there's a link there. There's training on everything from open disclosure to clinical audit, human factors, simple things like library services, change and innovation. There's so much there that you can learn from, and picking topics that you're interested in is a really good way to start your work on QPS, because if you're picking something you're interested in, it can help motivate you, and also, you know, will fit with what you need to be changing or doing locally in terms of, you know, yourself better than anybody else, the gaps within your expertise. And as you begin your QI journey, it's really helpful to connect in with others that are in this area and have that level of knowledge, and they might be able to help direct you as well in terms of good programs or courses that are there. There is also a QPS network map. You do not need to be an expert to join this. You just need to have an interest in quality improvement, and it's accessible online. You just Google search for it, you'll find it, and you can put in your contact details. You'll find people within the community that are interested. And as Levette said, a lot of this is finding people within your own area that are interested in this particular topic, because it's not something you do by yourself. Quality improvement, you need a community, you need a team to help keep you motivated. You could also join the Q community once you have a little bit of experience and knowledge and thinking about your quality improvement work. A lot of us are doing quality improvement work, but don't call it quality improvement. But invariably, if you're working to improve your service, that's what it is. And you can join the Q community to get other ideas, knowledge, expertise, training, and so on. It's free to join, and the details are there online. Our next webinar is on the 17th of January. And we look forward to sharing our programme with you for 2023 in the coming weeks and months ahead. And as I said, if you have any ideas for the coming season, just let us know, because we want to make sure that this is relevant to you. And finally, we do have a short survey at the end of every QPS Talk Time. We'd love to hear your thoughts on today. And last but not least, just to say a very, very happy Christmas to everybody. We hope that you have some time off in the middle of the next few weeks, and that you get to spend it with those people that are most important to you. And to those that are working the shifts over Christmas, thank you so much. We look forward again to linking in the new year. And as always, keep in touch via Twitter, send us a message via our email address. But thank you for joining us for every single QPS Talk Time this year. Take care.